I read a report yesterday that insurance companies, healthcare companies, were going after the senior market, and they weren't saying why. They don't want to say this. It is like, the insurance companies don't want to let everybody know just yet, or the government doesn't want everybody to know that in 6 months they don't have to take Medicare. And it's going to be a windfall. It's going to be great for health sharing ministries. But so that is exactly what's happening. And now these insurance companies are being downgraded because what's going to happen is not only, so here's what's interesting. Some of the going after the seniors, you have to be aware, make sure you're not getting yourself into some sort of, Medicare Advantage of some sort. You don't want to do that. If you do take Medicare, you only take original Medicare. Don't go to AARP. Don't go to anywhere else. Don't go to an insurance company and say, oh yeah, I want to, because they're always going to push you and sell you into one of those Advantage programs. Hence why we are seeing this huge uptick on senior citizens getting into debt. And when you look at it, most of them are getting into debt because of healthcare costs. They go in the hospital, they fall, they break their hip, they go in and they find out, oh, the anesthesiologist, he wasn't part of the system. The hospital was, or the surgeon wasn't, or the surgeon's, something else wasn't. Or he didn't use an approved Medicare Advantage hip replacement or so. There's all kinds of things that just because you go into a hospital that's in the network doesn't mean everybody you see is. And so they're coming out of the hospital, they're getting these bills for $30,000, $40,000, $50,000 for things that weren't under the plan. That's why if you use good old regular Medicare, that you can go to any hospital you want, you go to any doctor you want. But the upside to this really is our healthcare care ought to get better, because it's going to be really hard for the government to enforce doctors to say, oh no, you can only do Medicare patients.